From the Toronto Star, I'm Sabah Itazaz, and this matters. COVID-19 has been a brutal revealer of the state of long-term care homes in Canada and how we treat our most vulnerable.
As I've said many times, we need to do a better job of caring for the people who built this country. The greatest generation saw us through World War II, and we need to be there to support them properly through this global crisis.
The first wave of a deadly pandemic shone a glaring spotlight on how under-resourced and ill-prepared Ontario's nursing homes were to cope with a situation like that. We all remember the horrible findings from that military report after Canadian Armed Forces teams had to be deployed to 5 of Ontario's worst-hit long-term care homes. Documents described some of the care as ranging from below best practices to borderline abusive and worse.
I read the report in full yesterday. We shared it with the provincial government of Ontario over the weekend. It is deeply disturbing. There are things in there that are extremely troubling, and we need to take action.
Now Ontario's seniors are preparing for the storm of the virus's second wave after spending the first in the isolation of lockdown.
I've been very alone, and I know that my neighbors have been very alone. And I know that I heard them calling from the door. That's our limit, that's to the outside world.
And with the second wave here, it's unlikely the full impact of the first lockdown, especially among many of the hardest hit homes, will ever be known. The numbers are already climbing. Dr. Nathan Stahl at the Sinai Health System just tweeted today that there are now more than 300 active COVID cases in Ontario's nursing homes with a fatality rate of 30%. Meanwhile, a recent STAR investigation found out that we might not have some of the crucial data required in a number of nursing homes to be able to gauge how much worse off COVID-19 left residents, possibly making them much more vulnerable to Wave 2. The STAR's investigative reporter Moira Welsh covered this, and she's joining me now to explain what's going on, what might be next, and pandemic aside, are long-term care homes making any systemic changes for the future? Hi, Moira. How are you doing? Thanks for joining me.
Hi, I'm good. How are you doing?
I'm good, thanks. So I want to start off with the root issues here. What kind of root issues in the long-term care system were exposed during this pandemic that have been needing to be addressed for years, frankly?
Yeah, it's a really good question. Overall, the pandemic exposed what I would call just the incredible neglect of this sector. For years and years, it has been sort of seen as the secondary cousin to hospitals. And while it is not meant to be a hospital, it's meant to provide homes for people. It's representing a demographic that is increasingly medically fragile and some really serious long-term health issues like severe dementia. So back in, say, the mid-20th century, when people started moving into nursing homes, they died much earlier and they just weren't as sick when they moved in. But in that time, to give you some context, in the mid-20th century, nursing homes offered a place where people went, usually because they were frail, or a place to go for 3 meals a day and some companionship. Residents didn't generally have medically complex issues, at least not the kind we're seeing today, because people simply died a lot younger in those days. Now, people don't actually enter long-term care until they have a number of serious health issues, including often severe cognitive decline. And so the needs for people are much, much different today, but governments haven't funded homes for the needs that the residents currently have. And that's a real problem. So we treat it as a second-tier system. And COVID showed that there was an incredible staffing deficit. To be fair, this is a problem across North America. But in Ontario, people like Doris Grinspun, who's the CEO of the Registered Nurses Association of Ontario, have been calling for more nurses and more nurse practitioners and more frontline staff to care for people and provide a lot more daily hands-on care per day.
Right. And those needs are obviously going to get more dire as we are in the second wave of COVID-19. I will come to that shortly. I also want to talk about the devastating effects that we saw on the nursing care homes during the first wave of COVID-19. Now with fresh outbreaks in 86 Ontario long-term care homes, what are the residents going through and looking to face?
They're already really vulnerable from the first time. And I think from the residents' perspective, the greatest fear is that homes will lock out their ability to visit, to see their loved ones, to have family come in and care for them, to have visitors, or just to simply be told to stay in their rooms once again. That was physically and emotionally destroying for people.
And as you mentioned in your recent piece, we might not be getting the full picture here on exactly how devastating COVID-19 has been on the quality of life for nursing home residents. Why is that?
It's a bit complicated, but I'll explain. Every quarter, nursing homes are supposed to do an assessment for a resident care plan. Resident care plan looks at a number of standardized questions, and that would include, does Mr. Jones have a worsening mood or depression? What about daily activities of life? Are they able to independently get dressed, brush teeth, brush their hair? Or are they declining in that area? It looks at the use of antipsychotic drugs without a diagnosis of depression. It looks at weight loss, increased pressure ulcers, and falls. So in real time, homes can look at those assessments for an individual person and see whether their health is declining. And then they can take action to try to stop that. An older person and you decline, it's really hard to build your skills back up again. So you want to mitigate that as quickly as possible. So that's the individual value of the assessments. In the bigger picture, researchers use them to look at what's happening in homes. And for example, in the COVID period, researchers will look at that data to see which homes managed based on, the amount of the number of people with the virus within the home, perhaps looking at staffing losses, but also looking at just what the homes did to mitigate the problems, especially the loneliness, when they were on lockdown. Some homes managed quite well, other homes did not.
So you're saying this data is inadequate or has not been collected from all of the facilities?
No, the story said it's likely that most did, but it's also likely that the worst hit, and that's for a reason. The government early in the pandemic passed some emergency measures in March and said that homes did not have to do these quarterly assessments of individual resident needs that would have led to that data that would go to CIHI, the Canadian Institute for Health Information. When a home was struggling, lost a lot of staff, they didn't do those. And other homes had the option not to do them as well. CIHI told me they don't yet know how many did and did not. A researcher from the University of Waterloo, Professor John Hurdes, believes that most homes did. But the problem is, it appears that in the worst hit homes, the data likely doesn't exist.
Right. And I do want to talk about some of these hardest hit homes that you also mentioned in your piece, something about discrepancies regarding places such as, for example, Hawthorne Place, one of the 5 homes which were given help by the military as well. And their assessment and the health indicators that CIHI received were different, weren't they?
Yes. And so what happened was I actually received this data from a source. It was a years-long worth of data that would have included the most recent period, which coincided with the period of the pandemic. It would be interesting to look at. So I started going through it and quickly realized that homes that were the worst hit showed perhaps some minor improvements or no real declines, which made absolutely no sense. Ultimately, what that meant from a data perspective was that nothing was added into the data for that quarter, for the quarter that represented the height of the pandemic. The data actually reflects the 3 previous quarters. It gets complicated, but nonetheless, those homes are missing that crucial piece of information.
We'll be right back. And now as we're heading into the second wave, does that mean we don't have a full assessment of how much worse off residents have become as a result of COVID-19 and the first wave? How does that impact how we deal with what's happening now?
So in broad strokes, I think we know what needs to be done. I spent a lot of time writing about the impact of isolation, for example, in the first wave. A lot of people are talking about that and the impacts. And the Ontario Long-Term Care Commission into COVID actually released some interim recommendations and said that homes need to let families and caregivers continue to visit with proper infection control practices in place. Individual level, because those assessments hold very valuable information that could be used to bolster the health of certain people in certain homes in the second wave, we don't have them for some homes. So if the assessments were done properly, they can expose issues like mental health and frailty that perhaps need immediate attention. So for those homes that don't have that information, they're coming at this from a deficit. Unless they take deeper action to really explore each individual, it's a loss. For other homes, that some of which actually had COVID outbreaks in the city of Toronto at Seven Oaks or at Sheridan Billet in Peel region, they continued to do the assessments and they looked at their indicators and then worked with residents, not just to see what was going on in the first round, but also to see how they could help them as time moves on, prepare for a second wave. What's really important to know is something called the fragility trajectory. And I mentioned University of Waterloo professor John Hurdy's spoke about that to me. And what it usually means is it usually falls in a downward motion, meaning that older people might recover from a problem or a health issue, but not quite. And then something else happens, which knocks them a little bit lower. And then it just spirals downward from there. So the concern is that there's not enough knowledge of the most frail people and how they will be impacted by a second wave because they're so fragile to begin with.
Several reports and revelations later, does it look like the long-term care system is more prepared for wave 2 of COVID-19? I remember in your last episode on This Matters, you and Raju talked about whether this was the ultimate crisis that would finally force the government to act. So what has happened since? Have there been any legislative changes or are there any on the horizon?
So two different things there. In terms of being better prepared, I think they are. A lot of relationships and partnerships have been built with hospitals, especially in some of the worst hit homes. The hospitals came in, provided a lot of infection control training to staff, which was very important. And I think some systems in place that would help people in a second wave. And I think those partnerships, it is my understanding that they will, in many cases, continue, which is really important. I think that there are a number of advocacy groups that are really banding together, working together, and sort of speaking with a united voice, which has a bit of weight behind it, politically speaking. It appears, I should say, that there's a better supply of the personal protective equipment, and homes are supposed to be sharing them with each other now as well, I've been told. So that's a good piece moving forward for dealing with COVID in a second wave, even though there are many concerns still about the lack of staffing, which is a huge, huge problem. In terms of transforming long-term care, bigger picture, no, there has been no real change. And I think that the Long-Term Care Commission, when they spoke about staffing today, they said there's no need for more study. You need to start hiring more people now and get on with it. And so someone like Doris Grinspun, again, from the Registered Nurses Association of Ontario, wants Premier Ford to make a commitment to that and start spending the money needed to hire more personal support workers, more registered practical nurses and registered nurses and nurse practitioners in homes.
And we're talking about the need for real change here in the bigger picture. After what we've seen and learned from this crisis, do you see that there might be a better allocation of funding and budget by the government and the system? Like you said, there's a lot of need for better staffing and other resources like that.
Yeah, the staffing is a key piece of it. I think there are different sort of pieces to transformation, but staffing is the bedrock. You really do need those hands or boots on the ground, so to speak, the people in the homes who actually have the time to care for people instead of rushing from one task to the next. It's just minutes every day that each worker gets to awaken people, have them dressed, and take them down to a dining room for breakfast. That is not a normal way to live. It's not a natural way to live. So the staffing piece of it is key. But the whole concept of how we would actually live in long-term care needs to be transformed. The transformation piece of it is key. And I've done a lot of research in this area. I'm about to publish a book in February called Happily Ever Older. And it looks at evolving ways to live as society, boomers, and Gen Xers age. And there's going to be some really big changes if we do it right. But the key piece of it is to create homes where people have friendships. They live in buildings that have a completely different design than the buildings in which we're living now. The ones that we're living in now have 32 beds in one unit. And so that means that you're living with a large group of people. That is not a normal, natural way to live. It creates a lot of problems, creates aggression and fear. And so that needs to change. Ontario is right now spending at least $1.75 billion on new homes and renovations, but they're allowing operators to build with the same old institutional designs. And that's a big mistake. The other piece of it is just creating new philosophies and approaches and models that focus on relationships between staff and residents. And if you want a key point to attracting more workers in an industry that is really struggling to attract more workers, give those people the opportunity to have a say in the residents' care, to feel like they're making a difference, instead of treating them like they're on the lowest rung of the hierarchy and they're just forced to run all day long. Give them work that has meaning, and it will make a huge difference.
So in a way, you're saying that perhaps a sort of societal rethinking also needs to emerge from this. There was a lot of talk about the deep-rooted structural problems with the long-term care system, but also, do you think it's generated conversations about how we as a society look at older people, at the most vulnerable people in our society?
Yes, I think ageism is rampant, except I do believe that through the pandemic, I think all of us have experienced a bit of isolation through various lockdowns and being unable to see some of the people we love and spend time with them. So I think when we saw those images of older people staring out from the nursing home windows all alone, looking like they're declining, very unhappy, I think in a way that resonated with us as well. And so there's a better understanding and a deeper connection that older people are not others. They're not different than us. They are us. We will become them if we're lucky enough to live as long as they have. So I do think that there is a societal rethinking. There's a real desire for people to live in a different way as they grow older. People are seeking connections with each other. They're not willing to sit quietly in a nursing home and meet the schedule of the home. People want to have a say in they live. And I think that will be part of a bigger conversation that grows from this experience.
And I think that the pandemic has highlighted that need for change and for connectivity for all of us. Thank you so much, Moira, for your time. You've been very insightful as usual.
Thank you for having me on.
I was speaking to the Star's investigative journalist, Moira Welsh. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.